This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the Manager of Corporate Communications for the Ministry of Health, Candice Alcantara.
Good morning. You have tuned into the Ministry of Health's virtual media conference, which provides an update on the COVID-19 response. Our panelists today are the Honorable Terrence Deyalsingh, Minister of Health, Dr. Naresh Nandram, Principal Medical Officer, Epidemiology, and Dr. Avery Hines, Technical Director, the Epidemiological Division. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, and I will moderate this morning's media conference. We begin with the presentation from the Minister of Health.
Thank you very much, Candice. Good morning to Dr. Nandram and to Dr. Hines. Very good morning to ladies and gentlemen of the media and to all persons listening on the various platforms and viewing on the varying platforms. Today is Monday, 24th August 2020. And Trinidad and Tobago has achieved an unenviable milestone where over the weekend we would have reached our 1,000th case of coronavirus. We are currently at 1,031. Our first case, just to remind the national population, was actually confirmed on March the 12th. And today, August 24th, we are recognizing our 1,000th case. In those 1,000 cases, unfortunately, we have had 15 deaths, and our deepest condolences go out to all of those families. Ladies and gentlemen, I'll be putting up a simple graph on the screen in a short while, and it could go up now, because now more than ever, we need the population more than ever to play their part in flattening the curve once again. The graph on the right is the graph that Dr. Hines would have introduced the country to last week. The graph on the left, that mustard-colored area which is outlined there, shows how the world reached its 20 millionth case. What may not be very clear is on the x-axis, the horizontal axis, from just before February 22nd. That is where the actual mustard line actually started. But you can't see it because it's not very clear. But the mustard line actually started just before February 26th. Then you start, and it accelerated at a very slow pace. Then at around March, you started to see the exponential growth, and that is where you can see on the screen. It took 38 days for the world to go from 5 million to 10 million cases. And then the next doubling, the next 5 million cases, only took 24 days. And you will see the area that is shaded mustard gets bigger and bigger as time progresses. When you marry that with the same graph that Dr. Hines introduced the country to last week, you could see we are following almost the identical trajectory. The virus was more or less controlled when we had our total lockdown. But once we opened back up and rolled back the measures and people started to move, our cases started to increase and started to increase exponentially. As we leave those two graphs up, I will explain those two graphs and what they mean by referring to two articles. One by Dr. Margaret Harris of WHO. And she says, we are still in the midst of an accelerating, intense, and very serious pandemic. It has not ended. She goes on to say, the more we come together, the easier it will spread. And this is what we have been urging people not to do. Don't have COVID parties. Stay home if you are ill. She goes on to say, it's not just about travel. It's about speaking and spending time together. That's what humans do. And she closes by saying, it's the perfect pandemic virus of our time. We are now living in the time of coronavirus. Ladies and gentlemen, for us to really get a handle on this and to bring our curve down a second time, which we will do, it requires the population to buy in, not to the theory, to the fact that the more you move, the more you congregate, the more this virus will spread. As I continue to implore the population to use the simple measures of social distancing, I will now refer to an article, an academic article put out by Dr. Jonathan Smith, an epidemiologist from Yale University, which I sent to all my contacts on social media yesterday, including those of you in the media who I have on contacts, who I have as contacts. He goes on to say, first, we are in the very infancy of this epidemic's trajectory. Understand this. We are nowhere near the end of this. This may lead some to think that the social distancing measures are not working. They may feel futile because, as you see in the mustard part there and in our local graph, the cases keep on going up. The question we have to ask ourselves, if we are not those of us who are responsible, what would our graph have been like? So he is saying, even though the numbers keep climbing, my interpretation of what he is not saying is, if we did not implement social distancing measures and masks, what would have been our faith? He goes on to say, the enemy we are facing, that is coronavirus, is very good at what it does, and we are not failing. We need everyone to hold the line as the epidemic inevitably gets worse. This is not an opinion. This is the unforgiving math of epidemics for which I and my colleagues have dedicated our lives to. And that graph on the right is what Dr. Hines said last week. This is the math of epidemics across the world as we enter this exponential increase. Everyone has to hold the line. This is the mathematics. To further emphasize what we have been saying about isolation, he goes on to say this. The basic mechanics of this mathematical principle dictate that even if there is only a little bit of additional connection between groups, that is, social dinners, play dates, unnecessary trips to the store. I hope this sounds familiar because I have been preaching this for the past couple of weeks. Stay home. Only go out to work. Only go out to the pharmacy or the grocery. He goes on to say the epidemic won't be much different than if there was no measure at all. You should perceive your entire family to function as a single individual unit. If one person puts themselves at risk, everyone in that unit is at risk. So, the person in Tobago who went out puts your family at risk. The person that is going to the bar which is close to watch CPL cricket, you are putting your person at risk. The party that the police had to shut down last week with 32 people, you are putting your family at risk. And he explains it brilliantly like this, in a way that we couldn't have. Seemingly small social chains get large and complex with alarming speed. Refer to the case of the Trinidadian who was ill, knows she was being tested, and went across Tobago. One person spawned over 200 contacts, Dr. Nandram.
Yep.
But he puts it in very simple terms. If your son visits his girlfriend and you later sneak over for a coffee with a neighbor, your neighbor is now connected to the infected office worker that your son's girlfriend's mother shook hands with. This sounds silly, but it is not. And I will just end with what he says. As advice to the population, this outbreak will not be overcome in one grand sweeping gesture, but rather by the collection of individual choices we make in the coming months. Ladies and gentlemen, I could not have said it better, but it is simply what we have been saying from these platforms now for months. In order for us to beat the curve a second time without jeopardizing the total economic activity of the country, without a harsh lockdown again, where only essential services were open, we are asking once again for the public to please abide by the low-cost, slightly inconvenient measures. Because I took a drive around the Brian Lara Promenade this morning, and again it was scary. You see 6 people on one bench with no masks on. You see 4 people around the tables where they play drafts and chess and so on. 4 people, not a mask in sight. But then outside the bank, where the mask policy is being enforced, everybody has a mask. But it just takes one person on that bench in Brian Lara Promenade to start off a chain reaction, which will again cripple the country. The fight of coronavirus is not only in the hospitals. It is not only at the Ministry of Health. As we said, and I remember my words clearly some months ago, as we started to roll back the measures, I said the baton was passed to the public. Although many sectors of the public are behaving responsibly, and I congratulate them and thank them, there are still pockets of persons who feel that these measures don't apply to them and that they are immune to the virus. You are not. As Dr. Smith and Dr. Harris said, the math of the virus is that we are not yet in the middle. We are still in the beginning. And as the graph shows, just put them up one last time, please, because a picture paints 1,000 words. As we open our economy, we are following the identical global pattern of economies that are opened with exponential spread. And the only way to overcome this is not by a total lockdown, but by personal responsibility on the part of every citizen in Trinidad and Tobago. So I hope these graphical representations of where we are really emphasizes the point that unless the vast majority of citizens come on board with these measures, we will not flatten the curve, and we may have to go back to measures that we don't want to employ. So, Ms. Alcantara, I want to thank you for the past few moments. I hope we have impressed upon the population the need for them to do their bit, and I thank you very much.
Thank you very much, Minister Deyalsingh, for that very critical reality check for all of us. And next, we move to the clinical update from Dr. Nandram.
Thank you, Ms. Alcantara. Honorable Minister of Health, Terrence Deyalsingh, Dr. Avery Hines, Head of the EPI Unit, Ms. Alcantara, Manager CorpCom, members of the media, and viewing and listening public. I'd like to present the clinical update for Monday, 24th August. Number of samples submitted, 19,461. Number of unique tests, 17,185. Number of repeated tests, 2,276. Samples testing positive, 1,031. Active cases, 851. Number of persons that have died on account of coronavirus in Trinidad and Tobago since the beginning of this epidemic now stands at 15. Patients discharged, 165. I'd like to speak briefly on the 17 facilities that we have on our parallel healthcare system. We currently have an occupancy rate overall in the region of 56%. We have a total number of beds available to us of 1,177. Of those, 658 are currently occupied. In our hospitals, at the Cora Hospital, we have 76 persons that are mildly ill. But at the Couva Multi-Training Facility, we currently have 102 patients, 5 of which are in the high dependency unit and 6 persons who are currently in the ICU. That brings us to a grand total of 178 persons in our hospitals. In our step-down facilities, we have a total of 320 persons, with 22 persons at the Balandra facility, 36 at Tacarigua, 28 persons at the Brooklyn facility in Sangre Grande, UE Debe, 53, UE St. Augustine at Freedom Hall, 44, UE St. Augustine, Canada Hall, 126, and at Napa, 11 persons. At our quarantine facilities, at the Home of Football, we currently have 18 persons, Chancellor, 27, Cascadia, 41, Paria, no one, and at the Regent Star, 32 persons. I'd just like to mention that at the hospitals, across the weekend, persons have improved clinically, and across the course of today, we're looking to move 40 persons from our hospitals at Cora and Couva to step-down facilities. And at our quarantine facilities, between our quarantine facilities and our step-down facilities, about 111 persons have improved and are well enough to be discharged to home, so we can allow them to go back to their families. Suspected cases stands at 42 persons, with 37 at Arima. No suspected cases currently at Cora, and 5 persons currently at Augustus Long Hospital. That brings me to the end of the clinical update, and I'd just like to speak briefly on testing. So if we could please have the first slide. So there's been some advances across the last 48 hours. But before I go into that, as it pertains to our testing facilities, I'd just like to disaggregate the type of tests that we have available to us. So there's routine testing, and these are the larger machines that run almost 100 samples, but it takes a few hours, between 6 to 8 hours, to actually run the test. And in addition to that, there's the logistical time of getting the sample to the lab and the reporting time that we need to take into account. So I'd just like to draw reference to and contrast this to a point-of-care testing, which is the GeneXpert machine. Now, there's some similarities, but also some differences, which I'd like to draw to the public's attention. So the accuracy and reliability of both these types of tests, both our routine testing that we've been doing since the start of this pandemic, and the point-of-care testing which we've been introducing, is very similar. We use PCR-based testing, which is recommended by the World Health Organization, which the Ministry of Health adopts and recognizes. The testing window for a patient coming in to be tested is also the same, because it uses the same technology. It's accurate from the first day of symptoms up to 10 days after. The samples are also the same. We use the same NP, or nasopharyngeal swab, which is the swab that we take going through the nose. The differences I'd like to highlight. So the setting that's required to do our routine testing is a high-tech molecular laboratory. It requires specialized staff with specialized training, and as a contrasted to the point-of-care gene expert machines that we've been discussing. These require minimal training. They're field machines that we're rapidly in the process of being rapidly deployed. Thus far, we've deployed these point-of-care testing machines at the Scarborough General Hospital and the Sandy Grande General Hospital. And these machines give a pretty quick turnaround time. They're able to produce a result in under an hour. So that's really one of the main differences that I'd like to highlight. The timeline between our routine testing and what we're moving to implement into our major hospitals and our district health facilities, it will bring the testing time down from hours, from routine testing, down to minutes. And the decentralization of this testing into our hospitals and our district health facilities will enable our health professionals to be much more agile in their processing of patients. When a patient presents at A&E, once these machines are deployed, our clinicians, our doctors will be able to determine whether or not a patient is COVID positive or negative while that person is in A&E. So those, I'd like to move on to the second slide, please. Now, across the last 48 hours, CARFA validated an additional testing site for the Ministry of Health. That site is at the Medical Research Foundation, and this is one of our larger capacity sites. And I'd just like to quickly go through this slide. So once a specimen is collected, it's usually brought into the Trinidad and Tobago Public Health Lab, and oftentimes that's routed to CARFA. In addition to that, Trinidad and Tobago Public Health Lab routes samples through UE. North Central is now taking samples on their own and no longer require samples coming in from the Trinidad and Tobago Public Health Lab. They now procure samples directly from within the North Central Regional Health Authority, including the hospitals and the quarantine facilities that they cover. The Medical Research Foundation, as I mentioned, was validated by CARFA during the course of this weekend and is currently operational. And the installation of a large capacity machine at the Southwest Regional Health Authority is ongoing. In addition to that, we've started the process of deploying the point-of-care testing machines at the major hospitals. So instead of taking a sample at a hospital and bringing that sample to a testing facility, we've brought the testing site closer to the patient to cut that logistical time in transporting the sample. So the testing will now be done in-house as soon as all these machines are deployed. Thus far, as I've mentioned previously, we've already deployed these machines at the Scarborough General Hospital and at the Sandy Grande General Hospital. That brings me to the end of my presentation today. Ms. Alcantara, I'll pass the floor to you.
Thank you, Dr. Nandram. And Dr. Hines will now provide an update on our epidemiological status as it relates to COVID-19. Dr. Hines?
Thank you, Ms. Alcantara. Good morning, Minister of Health, Dr. Nandram. Good morning to the members of the media and the members of the viewing and listening public. What I'm going to do today is I'm going to take off a bit on what was shared by the Minister in terms of the global epidemiologic picture, and I'm going to map that back to our own epidemiologic situation. There are a few key points that I think it's worth repeating, that it's worth emphasizing with regard to the information shared. The first part is that the early part of any epidemic is the stage and the phase in which you do see rapid increases in the number of cases diagnosed. That's the stage that we're at, that's the pattern that we're seeing. And the second comment that ties to that with regard to the unforgiving math of epidemics is what I want to explain in a little more detail. The speed with which the numbers increase, the speed with which a virus propagates itself through a population depends on a combination of factors. The main factors that drive the speed would relate to the number of or the proportion of the population that is susceptible, which in the global context is everyone who hasn't had coronavirus, and the number of persons currently infected and infectious.
as the number of infected persons increases, the speed with which the numbers double, multiply, whatever you want to call it, that speed also increases because you have an almost unlimited number of susceptible people. That increase and that increasing increase, that rapidly accelerating increase, is what we call exponential growth, and it is a feature of all epidemics. Another word for exponential is logarithmic, and that is the genesis of that log abbreviation that you hear us using. Now, the reason that this transmission takes place at this speed is because persons come into contact with one another. The emphasis on the measures to reduce the probability of contact, the things that we've been asking persons to do, that emphasis has been again underscored. The importance has been repeated in the article that the minister shared. Each time we have contact between networks, we have an increased risk of exposing a new network of susceptible persons to viral transmission. And for that reason, we keep asking and we keep emphasizing that the restriction of unnecessary movement be observed, that the hygiene measures be observed. What we're seeing, what we have seen in our contact tracing, is that one network is connected to another network by various social gatherings. The social gatherings have taken place in various settings. We've mentioned several of the settings, but once one family or workplace network is connected to another by a bar line, by a church group meeting, by a family line, those congregations of persons expose another web to transmission. And that's what we are emphasizing that we need to prevent. The measures that we implement will take some time to work. We are now 1 week out from the implementation of the restrictions, and while we're still seeing an increase, this is what is expected, but we needed to hold fast to the measures. I'm very glad that the article emphasized exactly what we've been seeing for the past several months. The numbers will continue to increase for a while, but if we hold fast to the measures, that speed with which it increases will eventually level off and we'll start to see fewer numbers. But only if everyone is adherent. The measures only work with strict adherence, with more than just the vast majority. Nearly everybody needs to cooperate because we have such an interconnected community. So the Ministry of Health, the health system, cannot prevent person-to-person transmission of the virus. The person-to-person transmission risk is reduced by the decisions that are made by individuals. What the ministry can do is what the ministry has been doing. We have increased the capacity for testing to enable rapid detection. We have increased the capacity for isolation and for provision of clinical care. So we have more hospital beds. We have more ability to put persons into step-down facilities to clear clinical space. But all of that will be null and void if we do not contain that person-to-person transmission. We cannot isolate or institutionalize the entire population. But the virus can run through the entire population if we don't follow the guidelines. And the guidelines have not changed. The guidelines include wearing of masks to reduce expulsion of droplets, washing of hands to reduce your contamination of surfaces, and also your contamination of your mucous membranes, maintaining the physical distancing to reduce the risk of transmission between persons if they have to occupy the same space, limitation of gatherings and of unnecessary outings. These are the things that only individual human beings can decide to do and decide to adhere to in order for epidemiologic picture to change. If we don't all hold the line, then the disruption that we have as a result of the implementation of measures, that disruption then does not balance out with the expected benefit, because we can't benefit if persons are still passing virus from one person to the other. So again, just to reemphasize, we need to stick with the program and continue the behaviors that will reduce spread so that our health system can continue to provide care and provide the service that is needed to ensure the preservation of life. Turn you back over to Ms. Alcantara.
Thank you, Dr. Hines. As we begin the question and answer segment, we ask media representatives to indicate your name and the media house that you represent. And please, no more than 2 brief questions, and we'll get through everyone's questions this morning. We start with 98.1, please.
And a very good morning again to you, Ms. Alcantara, Minister Deyalsingh, Dr. Nandram, and Dr. Hines. My 2 questions, one for Dr. Hines and Dr. Hines and Dr. Nandram, and the other for Minister Deyalsingh. But I start with Dr. Hines. Dr. Hines, what should be the rule for public service transport, such as the water taxi service? Someone reported having been stopped from entering the water taxi on the Port of Spain to San Fernando route because they had a face shield and not a mask. This person, I understand, is asthmatic with acute breathing problems. What would have been the right course of action for both this passenger and the taxi service? She claims that she cannot wear or she cannot be masked for obvious health reasons and may have been denied traveling. And Minister Deyalsingh, there appears to be a gray area or a loophole or a lacuna in the law, if you will, in the public health regulations. I'm looking at chapter 12, number 4 regulations, item 3K, under religious gatherings. Maybe you can assist in further clarity. Now, according to the provision, it is said that it is an offense for a person to conduct religious or ecclesiastical services or any other religious gathering for the period so described. The question being asked is, can places of worship engage in in-house online streaming activities, observing the 5-member person rule, where they will have an opportunity to reach a wider home audience? Thank you.
So I will take your second part first. So that came to my attention over the weekend, and I'm having the legal department at the Ministry of Health prepare an opinion for me, which I will then send to the Honorable Attorney General. And if we have to amend the regulations, we can. But as we always say, without referring to that, we are just asking people to stay home. If we start to nitpick everything, we're in a bad place. So we will get a legal opinion. I agree, it may need some clarification, but in the interim, I have just read from 2 scholarly articles. Just stay home. If everyone just stays home and only go out to work, to the pharmacy, to the grocery for something essential, we will be fine. But I will get the legal clarification, and it did come to my attention. Thank you very much.
And we have the second question on the face shield. You said
Yes.
face shield?
I can address that one. So, face shield versus masks. Masks do effectively 2 things. The first is that someone that has the virus, because these virus particles are transmitted through coughing, talking, via droplet infection, the mask captures those. So if someone has a mask on, they're less likely to transmit the virus. A mask will also afford a certain degree of protection against the virus. A face shield, on the other hand, simply protects splash against someone's mucous membranes directly. It still is, in theory, possible for someone with a face shield to contract COVID-19 because they're still able to breathe. Virus particles can move around the face shield. And in addition to that, this assumption that masks impair breathing may not be as significant as some persons believe. There have been many clinicians that have come out, posted videos, actively showing their real-time oxygen blood level and showing that there's absolutely no difference in your blood oxygenation level when you wear a mask or not. I know of several, and I'm certain there are many clinicians that have asthmatic conditions and other conditions, and they wear masks all day, every day. I've been in surgeries that last for hours on end, 5-6 hours, with colleagues that are severe asthmatics, wearing masks the full way. So we would encourage the public, please, please, it's not just about you, it's about protecting everyone. Please continue to wear your masks. I hope that addresses the question.
Thank you very much, Dr. Nandram. And now we move to I-95.5. My apologies, I-95.5, please. I hope you heard.
Yes, good morning to you, Candice. Morning to everyone else.
Morning,
Whitfield, 95.5. Dr. Nandram, I believe you might be best suited to answer these questions. First of all, I want you to speak specifically to the issue of testing capacity in Tobago. Now, last week at the Post-Exec Council, we were told that there was a backup of 170 odd samples for testing here. And the GeneX machine runs about 2 samples per hour. Is there any way that that machine can be adjusted so it can run an increased number of samples within the same time frame without compromising the issue of accuracy? And the second question, if you can also speak to the issue of thermal scanning. We're getting increasing concerns about persons who are unwilling to be scanned on the forehead, and some persons saying scanning on the wrist is not as accurate as the forehead. So if you can speak to which option is better, or if both are recommended, and some guidance as to how persons should go about doing the thermal scanning. Thank you.
Thank you so much for your question. Just to tie up the last bit, the Ministry of Health will send out a public communique with regard to face shields. All right. To address your first question with regard to the testing capacity in Tobago, the gene expert machine that is currently deployed in Tobago is a low capacity machine, but it gives a very, very quick turnaround time, and it was put there primarily to address the urgent need of clinical patients. And that's that differentiation that I tried to make this morning between our large routine sampling and the quick turnaround time that allows our clinicians that agility to respond to a patient that's sitting right in front of them in the accident and emergencies. So the machine in Tobago can't go beyond two tests every 45 minutes or so, and that gives it roughly a capacity of roughly 50 a day. That being said, Tobago has we've always had a very good relationship with Tobago when it came to testing, and that backlog that you cited, we was sent down. Well, at least the majority of it was sent down to Trinidad, was tested here, and those results were already sent back. So, we stand in full support of Tobago to run any backlog that they have here in Trinidad. In addition to that, the Honourable Minister had indicated plans to put forward to put a larger capacity gene expert machine. Instead of a 2-site this time, we're looking at something with a larger capacity that will significantly increase their capacity in Tobago to do testing on island, thus enabling them to respond to cases that they have there with more agility in a shorter time frame. But at any rate, the labs here in Trinidad remain able and willing to support testing needs of Tobago. With regard to thermal scanning, scanning on the wrist and scanning on the forehead is acceptable. Either way is okay. With regard to the notion of radiation and that sort of thing, some people put out some very interesting notions about what it does to their brain. Thermal scanning is safe. It's an infrared thermometer and that's the same infrared radiation that you get walking around in sunlight. So scanning on the forehead and the wrist, both measures are acceptable, and it really doesn't pose a health risk. I hope that addresses the question.
I would just like to raise one issue, because Whitfield, you raise a very important issue, which the CMO spoke about on Saturday. But unfortunately, a narrative is being put out there that persons are dying while waiting for COVID-19 tests. And I have 2 doctors here. The CMO made the point that doctors don't treat tests. If a patient presents, the patient gets all their treatment based on their symptoms. But there's an unfortunate narrative being put out there that maybe 1 or 2 persons are dying because they have not received their COVID-19 tests. Even before COVID, and I want the doctor to go into detail how doctors treat patients whilst waiting for tests. So Dr. Nandram and Dr. Hines, please speak to this issue.
Well, before I pass on to Dr. Hines, I'd just like to say that we're emphasizing the message that was put out earlier by the Chief Medical Officer, Dr. Parasram. Doctors and clinicians and health professionals everywhere are well aware that we treat the patient in front of us. We don't treat a piece of paper that a test comes on. We treat the patient. I'd also like to bring it to the public's attention that there's no specific treatment for COVID-19 at this time. The treatment recommended by the World Health Organization is supportive care, which does not require a test for us to do. So that supportive care is given to every patient, whether they receive a test result or not. I don't know if Dr. Hines can go into a little more detail on that topic.
Thank you. To continue where Dr. Nandram left off, when a patient is clinically assessed at any of the public health institutions, the only role that a positive or negative COVID-19 test result will play is in determining where or in which facility the patient will be admitted. All of their clinical needs, their needs for support with regard to oxygenation, with regard to hydration, with regard to any medication that is required, all of those decisions are based on the clinical assessment of the patient, meaning the doctor examining the patient, running other tests beside COVID-19 to see what sort of physiological, meaning body function, derangements there may be. Anything that's out of sorts will be addressed by all of the standard medical means. And that's what we mean by supportive care. Anything that needs support to return to its state of equilibrium is supported by your general medical care. Decisions for admission are not made on the basis of whether you are COVID-19 positive or not. Decisions for treatment are not made on that basis. But the COVID-19 test will then allow us to redirect a confirmed person to the parallel healthcare system. And as you may be aware, there is an existing system for what we refer to as suspect cases, meaning persons who may be ill, we don't have their result, but they require care. And that care is currently being provided. So I hope that that addresses any misconceptions about the lack of a test result impacting on quality of care.
Thank you very much, Dr. Hines. And we welcome back Astronaut News. Please pose your question.
Astronaut Health News, Gwyneth Stewart. Good morning, everyone.
Morning.
Good morning.
Nice to see you, Minister Deyalsingh.
Nice to see you.
So, a question. Medical science shows that a strong, healthy immune system helps in combating any type of disease, whereas a weakened immune system causes one to succumb to diseases more readily. And with our present alarming state of community spread, while we are practicing staying indoors when sick and sanitizing, washing our hands frequently and physical distancing and wearing of masks, which are excellent strategies for the externals, isn't it wise to attack from the inside as well by practicing strategies to strengthen our immune systems? And shouldn't we be stressing more on these measures? So in the same way that we say, wash hands, physical distance, sanitize, wear masks, shouldn't we also say, get enough sleep, don't smoke, eat less refined foods, drink more water? Even if we are inside and practicing habits that weaken our immune systems, we will get sick. So my question is,
Astronaut, we need to keep the question short. I think we have gotten the drift, but we want to allow other people. Let Dr. Nandram answer, please. Thank you.
And also, is it...
Thank you so much
Is it-
for your question. So the short answer is whatever persons can do to keep themselves healthy, we would encourage them to do.
Okay, thank you very much, Dr. Nandram. And again, brief questions, everyone. AZP News, please.
Hi, good morning. Priya Hari, AZP News. Good morning to everyone. My first question, I wanted to find out, I asked and I don't think I got a proper answer about patient 139. Can you give me some detail when, if not today, sometime, when the person, had contracted, etc., and where the person now? And my second question has to do with bed capacity. Minister, initially you said that when we're looking at capacity, we look at 75%. I think initially the bed capacity was 948, and I think now we have 1,177. 75% of that, I think, is 882 around there. And we have 851 patients, active patients right now. So there's a difference of about 30. Are you now looking to increase the number of beds we have available, and where and what cost, and how would that affect the ratio of patients to healthcare workers?
Thank you. Excellent question. So as I indicated on Saturday, we will be operationalizing new facilities at the DB Penal campus, 110 beds, and we will be operationalizing facilities at the UTT campus at the Deyalsingh Teachers College, another 100 beds this week. So that will give you an additional 200 beds prior, okay?
And information on patient 139.
I don't have that information.
Provide that at a later time.
We will try, as long as it doesn't break patient confidentiality.
Okay, thank you very much. And we move now to 91.9, please.
Hello, good morning. Can you hear me?
Morning, yes.
Morning.
Yes, we can.
Yes, good morning. Blue Next Devo here from 91.9 FM. Just two quick questions with respect to how the Ministry of Health can advise persons operating private businesses in terms of how they treat with their particular persons who may be going for a COVID test. I got a complaint this week that the employee went for a COVID test, and even though they went for a COVID test and were supposed to stay at home, they were asked to come out to work by their employer. And the second question is, in terms of private labs, I also have some information coming to us at our news desk that there is a private facility offering testing for COVID-19, and sanitization in the room that the patients are being tested is not being observed, as well as patients leaving the room without their mask on after they've gotten a test. Everything is happening with that person who is getting COVID tested intermingling with other patients who are there for other matters. Could you address those two issues?
Okay,
Thank you.
so what I will suggest you do, you send me that information about that institution offline, and we will certainly investigate it. It sounds very, very distressing. The first thing about workplaces, we have sent out to the various chambers of commerce workplace protocols and regulations, so they are free to refer to that. They are also available online on the ministry's website.
Thank you very much, Minister. And we move now to CNC3.
Hi, good morning, everyone. Rashad Khan, Guardian Media. How are you all going?
Great, thank you.
Thank you.
How are you?
All right, welcome back, Minister Deyalsingh, to the panel.
Thank you.
All right, so I'm going to keep it extremely brief with my two questions. And since it's the first time I'm questioning you back on this panel.
Okay, so let's be brief.
Yeah.
Forget the long
All right.
run-up.
All right, cool. So what is going to be our next step now when we see more cases coming in? Because you said you're going to ramp up testing and those sort of things. So obviously we may pick up on more cases. We already started to roll back on some of the criteria for discharge and for stepping down patients. And now my second question, really quickly, is to Dr. Nandram or Dr. Hines, whichever one of you. It's now about 2 or 3 weeks after the election. And in that time, we've seen over 700 cases of COVID-19. And I know in that week after the election, you all anticipated a spike in cases. So now, have you all identified, and how many persons have you identified in your contact tracing exercises of persons who would have been at election related activities, campaigning, motorcades, that sort of thing?
Okay, so I'll take the first question first. New measures are always being thrown about at the ministry. We meet 3 times a week on this. And if we feel there's a need to advise the Honorable Prime Minister on new measures, we will. And I'll let Dr. Hines answer the second part of the question.
Okay, thank you for the question. As you may or may not have heard at the press conference immediately after the election, one of the questions asked was exactly that: how many persons identified themselves as having been at various election-related gatherings. And I did say at that point in time that no one identified themselves as having been at these gatherings, which does not mean that they weren't there. But the information that is shared with us as healthcare professionals is the only information that we can document. So it's not going to be easy or perhaps even possible to determine how many of those persons that have been contacts, that have been positives, were at a gathering of any kind without the information being provided to us. And as I said, that really depends on what the patient divulges.
Thank you, Dr. Hines. And now questions from TTT.
Good morning, everyone.
Morning.
I'll try to be very quick. I'm not too sure who will best able to answer.
Just ask and somebody will answer.
All right. I'd like to zero in on establishments where employees are perhaps confirmed, an employee or employees confirmed as COVID positive. Can someone quickly walk us through the protocol for informing staff of the development, the period for closure of sanitizing, and because my understanding is that it's varying across the board. Some establishments are withholding information, not shutting down, and asking employees just to remain vigilant to protect themselves.
Thank you so much for your question. So the Ministry of Health published some guidelines as to how we should be reopening, but with specific regard to your question, if there's a positive case at any place of business, the first thing, our first priority is to get that positive patient into a healthcare facility to ensure that they don't decompensate and we don't have another family member being lost to COVID-19. In addition to that, all primary contacts, meaning that persons that were in contact with the positive case for a period of more than 15 minutes within 6 feet without wearing appropriate PPE, are immediately quarantined and are subjected to testing. Secondary contacts, meeting that same criteria, who are in contact with the primary contacts and tertiary contacts in turn, are also asked to quarantine. As soon as the Ministry of Health is made aware of the case and made aware of the business, we reach out to the business owners or the managers immediately and ask that everyone be quarantined and ask that the establishment be shut down immediately for sanitization. I hope that answers the question.
Let me just clarify further. This question was asked, it's a very good question. This question was asked of the CMO a couple of weeks ago, and he did say at that time it is difficult to have a one-size-fits-all solution to this. It depends on the size of the organization. I had a call this morning, and the CMO did say, so if it's a truck driver only driving a truck, then it is localized within the truck. However, as the CMO said, if you have a messenger going from floor to floor, then the procedures are different. So it is difficult to have one glove to fit all sizes in this. But there are protocols online that any potential employer could look at, and the Ministry of Health will reach out and assist as far as humanly possible. But it's an excellent issue to raise. Thank you.
Thank you, Dr. Nandram and Minister. We move now to Channel 5.
Hi, good morning. I want to first get some clarification on the law as it relates to fishermen, because we had a case on Sunday where a fisherman went to bail out his boat after the rains were coming on just to make sure his boat didn't sink, and he was arrested and charged. So, I mean, the fishermen here now, they're now actually wondering, where does the law state with regards to them? Because, yeah. So I just want that question addressed, as well as what is the update on the team that's supposed to come to Tobago to look at the system as it is right now in Tobago and how it can be improved as cases come in.
So, on the issue of the fishermen, I can't speak to it. I don't know about it. I will certainly reach out to the Minister of National Security, who can talk to his Commissioner of Police to find out exactly what happened. But it sounds a bit odd. Yes, the team did go across on Friday. I got an oral report this morning, and they'll be giving me a written report this afternoon. So I will be getting a written report this afternoon.
Thank you, Minister. And we move now to TV6, please.
Good morning, everyone. Urvashi from TV6. Dr. Hines, you've spoken generally about persons being exposed at bars and schools, but have epidemiologists been able to tie any clusters, particularly back to specific events like engagement parties, funerals, weddings, etc.? Second question, Dr. Nandram, the numbers of persons en route to facilities have been upwards of 200 from since Friday, Saturday, Sunday. Today, it's 285. But the number of positive identified cases in any 24-hour period was between 66 and 100. Is there a backlog in or waiting time attached to a case being identified and that person being admitted to a facility? Thank you.
Thank you very much. We're going to Dr. Hines.
Okay, thank you, Urvashi, for your question. The epidemiologic investigations done so far have, in fact, tied several clusters that weren't related to each other initially to some of the gathering places that we have identified and spoken about repeatedly during the press conferences. We did see several webs contained, or connected rather, by a card tournament that went from one bar to the next. We saw webs that were connected to persons attending religious gatherings while ill. We saw persons in workplaces when they were ill and symptomatic generating webs of contacts, and if those persons then went on to any other informal gatherings, they connected other networks of people, and the contact tracing did reveal same. So yes, we have been seeing epidemiologically, not just in Trinidad, but in other countries, that sort of relationship between gatherings and the potential explosion of connected networks and transmission of illness.
Before we go to Dr. Nandram, because Urvashi raised a very good question, we don't have to wait for those webs here. There's a global ranking of situations that lend themselves to clusters. And if you get that global ranking, I'll probably bring it for Wednesday, you will see bars rank #1. You will see places of religion rank very highly. So we don't need to wait, although we have had it, to be proactive. So I will get that ranking and probably show it on Wednesday. Thank you very much for raising an excellent issue.
To address your question, Urvashi, thank you so much for your question. The period of which you're referring to spans more than 24 hours, and because our testing in several facilities runs across the night. Prior to our updates, just before 8 o'clock in the morning, we usually get the reports of all the positives coming in, immediately before. So we usually get updated with those figures just before we come on. That also contributes to why it looks like there is large figures coming in. The facilities have room, and the process of bringing a positive patient in is a little bit involved. The first thing we need to do is advise the patient and then coordinate with the clinical team to bring them in. So when we're notified of 20, 30, 40 cases immediately before, those will be brought in during the course of the day, and it's something that we are consistently working on. Patients aren't brought in at any one point in time. They're brought in consistently day or night. And so, but the figures just represent a snapshot. All right, I hope that answers the question.
Thank you, everyone. We have come to the end of today's media conference, and we remind you, please, to follow the new normal guidelines all the time. Thank you very much.